Hello everyone, this is Dr. Batts again. First off, I want to say this has been a riveting Go Red month. I have had the opportunity to speak with many people about heart disease. The first group that I had the chance, I want to send a shout out or a thank you to the Alpha Tau Omega chapter of Alpha Kappa Alpha Sorority, the San Antonio chapter. They brought me in and did a super job of getting a group of concerned individuals who wanted to know more about heart health, specifically in regards to women's health. But just a few takeaways, because again, when I give lectures, what I like to do is not only lecture for the people there, but I want to get something from it too. So even as a physician, there are things that I can learn about heart health, specifically in regards to women's health and other groups that aren't necessarily as well studied. So the first thing that I learned, it was very interesting when it comes down to learning and understanding kind of how important heart health is. There was a nicely articulated study in the Journal of American College of Cardiology in 2017 that actually looked at what women's awareness was to coronary artery disease. But this study revealed that only about 45% of women knew that cardiovascular disease was the #1 killer of women. 45%. Now, I'll post a graphic here, and what you can see, which is actually more striking, is that when it came down to primary care doctors prioritizing the role of cardiovascular disease, and again, this by no means is an affront against primary care doctors, but the study just highlighted that in many cases, just due to time or due to other constraints, they weren't able to prioritize cardiovascular disease. That said, only 39% of primary care physicians, based on the study, this isn't me making this data up, it shows in the data, actually prioritize cardiovascular disease in women. Now, what also was determined from the study in this last graphic, it reflected that only 22% of primary care doctors and somewhere there about 42% of cardiologists were actually able to articulate the risk of cardiovascular disease to women. The study suggests that younger women, upwards of 58% of younger women, were unaware that cardiovascular disease was the #1 killer of women. More concerning, when we broke that down into whether it be socioeconomic status or level of education, more concerning was when there was a large racial disconnect such that both African American women and women of Hispanic descent, as delineated by the study, were more unaware that cardiovascular disease was a #1 killer. Now, despite that, some of the thoughts in regards to physician, even myself, felt that, well, again, women articulate pain differently, and so that's what makes it hard. Well, the Virgo study in 2018 suggests that that's actually not the case. In many cases, even individuals such as myself, well, I'll just talk about me, find it difficult because oftentimes what is discussed isn't as straight to the point. The Virgo study in 2018 identified that sex differences between males and females changes the perception of physicians when they articulate chest pain. Interesting. What the study highlighted was that although both men and women presented at a relatively similar rate with similar symptoms, it was often thought in males more so than females that their symptoms were attributable to chest pain. The graphic reflects that providers did not think symptoms were related to heart pain by percentage. So the higher percentage, i.e., as you see in women, it reflects that the providers did not think those were due to cardiac symptoms. What you find out is both were tested at a similar rate. However, that perception that the symptoms are due to heart disease is something that oftentimes will trigger physicians to order more tests, to become more aggressive with counseling. But in any case, this identifies that although women may articulate pain in a different way, chest pain is still the presenting complaint, oftentimes. And so what that should prompt physicians to do is to work to pull that out of women so that they can understand how to best care for them. Now, prevention is what we also discussed. Now, prevention is in patients that you've identified with risk factors. Those risk factors can range from everything from family history to obesity to high blood pressure to cholesterol, you name it. But in many cases, how you approach those risk factors is important in reducing cardiovascular disease. Now, my strategy is fairly simple. I focus on a few key things. Diet. You all know I enjoy the value of plants, but again, understanding how to have a healthy, balanced diet with a reduction in saturated fat that helps your body to both heal and do. It is simple. The steps for primary prevention are there, right? A healthy diet, right? So on the physician side, counseling patients to that regard, regular physical activity, that's more than just a casual walk, that is at least 4 days a week of greater than 30 minutes during that time frame, working to lower blood pressure. And again, this is for primary prevention. Primary means they have not had a disease manifestation yet. And then estimating your 10-year ASCVD risk or your atherosclerotic risk every 4 to 6 years. Now, this is the recommendation for individuals 20 to 75 years old. So in order to get a handle on your heart health, whether you're a male or a female, start with diet, exercise, making sure you get adequate sleep, maintaining a level of community connectedness such that you can improve. Again, thank you for this great opportunity. Stay tuned. Next week, I'll be speaking to my beloved fraternity. That's right, the brothers of Kappa Alpha Psi Fraternity Incorporated, San Antonio Alumni Chapter. We'll be talking about heart health in men. Get ready. Here we come.